I'm Mark Golub, and as always, it's wonderful to be with you for another in our series Gam Yachad, Together during COVID-19. I hope you're all doing well today, and in general for that matter. And to all of you who may be joining us for the first time on Comcast Xfinity, welcome to JBS. I hope each one of you has been doing well and that you'll enjoy many wonderful hours with us here at JBS. And the array of JBS programming will keep you good company during this oppressive pandemic. But I'm sure you know there's a big week in the battle against COVID-19. For this week, the first vaccine is being distributed to the public. In the United States, healthcare workers and the elderly and long-term care facilities will be receiving the vaccine first, then those designated as essential workers, and then those who are 65 years or older, or anyone with a serious underlying health condition. And it is estimated that by this summer, if most people agree to be vaccinated, the United States will be approaching herd immunity, and won't that be a sea change in all of our lives? So we can really see the light at the end of the tunnel. And as one viewer wrote me, how appropriate that the light comes during Hanukkah, the festival of lights. At the same time, societies across the globe are still dealing with increasing cases, increasing hospitalizations, and with increasing deaths. And it's not just those suffering from COVID-19 who need medical care. In many instances, there are long-term effects of the virus which create serious health issues for a person's life after recovering from COVID-19. And one physician who's been doing some marvelous work caring for those suffering from long-term after effects of the virus is the director of the Institute of Pulmonology at Hadassah Hospital in Israel. He's one of Israel's top experts in the field of respiratory diseases, which is the system that COVID-19 attacks. His name is Dr. Neville Berkman. He joins us now from Jerusalem. Neville, it's a pleasure to welcome you to JBS. Thank you for joining us.
Thank you very much for having me. Very happy to be with you.
Thank you. Neville, I want to speak just for one moment about you and your Jewish background before we go to the virus. You made Aliyah from London. What was your Jewish upbringing like, and what prompted you to make Aliyah?
So I will correct you at the outset. I was born in Johannesburg in South Africa.
Aha.
And I grew up in South Africa. And I was I went to Jewish day school, and I was very involved in the Jewish youth movement in Bnei Akiva as a child and as an adult. I was a young adult. And I finished medical school in Johannesburg. And I then came on Aliyah. And since making Aliyah a long time ago, 1986, I've been at the Hadassah Hospital in Jerusalem. I did actually spend a few years in London doing a research fellowship at some point, but
okay.
That's my only connection with England.
The notes I saw, and they must be wrong, is that you got your medical degree from London. So, and that's why I thought you were born in London, but I understand ultimately you're South African, you make Aliyah because you've been involved in the Youth Zionist movement from your youth, and although you were in London, it was only for a brief period of time.
That is correct.
Okay.
That is correct.
So let's talk now, Neville, about some of the issues related to COVID-19. First of all, what is your advice to others about being vaccinated? In the United States, more than half of those polled indicated they are either unsure if they want to be vaccinated or they're actually opposed to being vaccinated. What's your advice?
It's a big issue in Israel too. We have been lucky enough to have a vaccine now becoming available in Israel as well. Nobody has as yet received the vaccine, but hopefully from next week or the week after that, people will start receiving the vaccine in Israel as well. And I must say that today I had at least 30 different people asking me whether they should get the vaccine or not. So I think this hesitance or this lack of confidence that people feel about the vaccine, I think is a universal phenomenon. I say to people, there is some risk with a vaccine, but that risk is much, much lower than the risk of the virus. And any risk related to the vaccine is hypothetical at this time. So the risk benefit is way in favor of the vaccine.
Neville, will you take the vaccine?
Absolutely. I will be. I think. I'll be amongst the first to get the vaccine for sure. Absolutely. People are wary about something that is new. The technology for the vaccine has never been used in humans before, at least for the Pfizer and for the Moderna vaccines. So people are a little cautious, and particularly I think younger people. For whom the risk benefit on an individual level, I'm not talking about as a community or as a country, yes, but from an individual point of view, the risk benefit for a young, healthy person is much less clear than it is for somebody who is older or somebody who's at high risk or someone who has associated medical conditions. I can understand that issue. I just think that COVID is a virus that is taught or is teaching us or should be teaching us a communal responsibility. I think that all along where communities have shown, responsibility from between people, that has been a secret to success. Yes, when people wear masks, not for themselves, but for their parents or their colleagues, or that is the way to prevent the virus spreading. And I think the same will be the case for the vaccine. So I think that somebody who is a 20-year-old healthy, fit individual should take the vaccine to protect his parents or his grandparents, and even if it's not for himself. So that is, I think, has to be brought across to people. And hopefully, I mean, that's what I would like to believe, that a kind of sense of responsibility of worrying about, other people rather than just, what's good for yourself personally will be the thing that will push people to get vaccinated, I would hope.
That is lovely. I hope everybody hears you and takes what you say to heart. Neville, I've had the opportunity to speak with many wonderful colleagues of yours from Hadassah Hospital over the last 9 months. And I wonder how much of what they thought was true when they spoke to me about COVID-19 in March and April, do they still think is true, and what the medical world has learned about the virus that we didn't know at the outbreak of the disease. What do you feel you have learned about COVID-19 that you did not initially know back in March and April?
Well, I would think that probably 90% of what you heard in March, people have discarded by now.
Isn't that amazing? Isn't that amazing?
Absolutely, absolutely. And I think it would be wise probably to trash this interview in a month's time, because most of what we'll say now is probably going to change.
Oh, but beautiful.
I do actually think that that's a positive thing in many ways. I think the fact that even our understanding has been so dynamic in such a short time, I think that in itself is extraordinary. I think this virus has taught us just how little we know, just how little we can be sure of things that everybody took for granted. If you would have said a year ago that people cannot get on flights or cannot, go overseas or cannot visit their parents or grandparents or go to see a, play or a movie, people would have thought you were off the wall. So I think it's don't take anything for granted, and I think it's also shown us how little we understand, how little our understanding of medicine and of the things around us is. I mean, we should. It's a lesson, I think, in modesty, that we should know how little we know. But on the other hand, I think it's been very encouraging in that so many people and so many organizations and so, from a global point of view, are trying to pull together to get on top of this. So, those are the things which have struck me most.
That is lovely. We were told initially the virus is not airborne. It seems that doctors say now that it is, and that people pick up the virus not so much by touching something with droplets of the virus on it, but from being in close proximity with someone who has the virus, especially in an indoor setting, and especially if the contact is for 15 minutes or longer. To what extent do you agree that this is now more true than we understood, that there is something airborne about the virus, and that it's interpersonal contact, being close to someone with the virus, that puts one at greatest risk?
I remember reading in March and April, there were a lot of publications, medical publications, about how long the virus will stay viable on a glass surface and a wooden surface, etc.
Yes.
But but I think that the reality has shown that what you have said is exactly correct. Yeah, people get the virus from being in close proximity to someone else who has the virus. And the masks have been, and there are many studies to show that masks protect, and being outside is much better than being inside, and keeping distance is something that prevents spread of the virus. So I think just from an epidemiological point of view, I think it's become extremely clear that that is the major method of spread of the virus.
Okay, by the way, you seem to feel masks are in fact very effective in protecting both the wearer of the mask and people who are in contact with somebody in a mask.
Absolutely. I think it seems that the most important mask wearer is the person who is the potential spreader of the virus. But if the two people are both wear a mask, it also considerably reduces the risk of the spread of the virus.
Okay, so Israel has had more than one massive lockdown, one provoking riots in the streets of Israel. What's your own sense of this balance between protecting the public and protecting hospitals from being overwhelmed, and at the same time dealing with the economic hardships lockdowns have caused millions of people?
No, that's a difficult question that I think everybody all over the world is trying to deal with. And I think most countries have dealt with it poorly, actually. I think quite unsuccessfully. And I think that Israel was very quick with their first lockdown, and I think that was very effective. So I think in March and April we had a tight lockdown, and over the preceding months, May and June, the number of cases in Israel was very small. In our first wave, there were less than 300 deaths in Israel.
I know,
which was
it was astounding, Neville.
Yeah, and then unfortunately, June, July, numbers went up, and I think that we were too slow to respond. I personally thought, and still think, that the system that's used in Australia and even Japan and some of the other countries in Taiwan, of a more rapid and more tighter lockdown. I personally think that was the way to go. I think it would have saved a lot of lives, and I think that it would have also got the virus under control more quickly. as regards the downside to that, which is the economic side to it, I think that dragging things over another month and another month just is more harmful for the economy than quick and tight lockdown. That's my personal feeling. I do think that one of the things that's very important, and again, this is not medicine, this is just my personal opinion, is that it's important that people whose income that have issues with income related to the lockdown, that they need to be taken care of. I think that it's the government's responsibility, the country's responsibility, to make sure that those people are not desperate to go and work because they know that they're going to get something at the end of the month.
Yes.
And I think if that was the case, there would be, there'd be less riots and less desperation to end the lockdown sooner than it should. But that's my personal feeling.
Were hospitals, was Hadassah Hospital, for example, ever overwhelmed by the number of cases?
No. None of the hospitals in Israel were overwhelmed by the number of cases. At the peak, which was, I would say, September time, we were opening up, new wards at about, I would say, at least one every 2 or 3 days. But the peak was relatively short. I would say the peak was around a month and a half. And we were never completely overwhelmed, no.
Okay, very good. So I want to talk about your own work. Your own work has been with those who have recovered from COVID-19, but then suffer serious after effects. First, can you give us a sense of what those after effects are and what you and your colleagues are doing to help people suffering from them?
So it turns out that COVID seems to be have effects that we're familiar with some other viruses, like kissing disease or Epstein-Barr virus or CMV viruses, which are viruses which have been known for a long time, and people often suffer prolonged effects from those viruses. And I think that COVID, we thought initially that, if you get out of hospital and you're okay, a week later, that's the end of the story. But we are seeing almost, I was looking at our numbers, 90% of our patients who were admitted with COVID have got some after effects. And we're talking about 3 months later, between 1 and 3 months later, almost 90% of patients have got some ongoing symptoms or disabilities related to their disease.
For example?
And the most common things that we've seen are things related to respiratory symptoms, shortness of breath, cough, and fatigue, weakness, muscle pains. But there's the whole gamut of things we're seeing. A lot of people complain of mental disturbances, depression, confusion, difficulty to think clearly. So the symptoms and the effects seem to be very broad and very varied. The very interesting thing that we've actually seen from our data is that there is not, as one would expect, a clear correlation between the severity of the initial disease and the presence of these kind of symptoms afterwards. Even the patients, although I have to clarify that our cohort, the patients that we're following in Hadassah, are mainly patients who were admitted. So they were more severe patients, but within the group of patients who were admitted to hospital, we're not seeing that patients, for example, who were admitted to intensive care or were in ventilators necessarily have got more long-term effects than those who were admitted to a regular ward.
Why do you think that is?
We're not sure yet. I think it goes back to what we said before about us understanding so little about this virus.
Yes.
We don't know. I think there's certainly a lot of symptoms that I would call the kind of post-traumatic stress-related symptoms. It's very hard also to know to differentiate or to tease out what of those symptoms are related to the general feeling of isolation, of being, social distancing. Those kind of things also have enormous effects on how people function. So it's very hard to tease out, what the major factors are. I hope that as we gather more information, that we will be able to try and we'll understand this better.
Yes.
Certainly in terms of major respiratory issues, those are obviously more common in the people who had more severe disease. So we started off, of course, I'm a respiratory physician, and we started off with, looking at respiratory effects of the virus. And we see that a lot of patients had breathing difficulties and persistent cough and a lot of chest pain. And those, of course, are more frequent amongst the patients who were ventilated, who are more severe.
Yes. Does age factor into this at all? Are you seeing this mostly in an older population, or is it across the board in terms of demographics?
So it's about the same between men and women, and it's about the average age of our patients is around 50, 52. Certainly do not see that the older patients necessarily have more of the, I would say, non-respiratory symptoms than the younger patients. The non-respiratory, I would say, or I would be a bit hesitant to call it non-medical, but the paramedical, psychological, I would say, stress symptoms, those seem to be across the board, not specifically related to age. But again, we're still learning. We're still learning. I'm not sure. It's one of these things that in a month's time you might tell me, well, that's
I understand.
That's changed.
The reason it's interesting to me is this notion that younger people who seem to have to be, as you said earlier, at a much lower risk, certainly of fatality, of death,
Right.
from the virus, that their attitude is different than somebody who is 60 or 65 or 70 or older than 70. And it may affect whether young people even want the vaccine. But it seems to me that if in fact there are serious after effects, and that they occur whether one is younger or older, it really is important, Neville, not to get the virus if at all possible.
Absolutely. I couldn't agree with you more. I see young patients as well, and that's exactly what they say to me. They say, we were not worried, or we did not, we were not concerned about getting the virus. But now that we've had the virus, we're just not getting back to normality. So you're absolutely right on that. I think that people have to think, and specifically young people, and maybe in people who are healthy, need to understand that it's not just, the week or two of the virus. I've survived the virus. I can go back to living normally. There are certainly consequences, there are long-term effects that, I keep saying this, that I don't think we understand and I don't think we appreciate. We're still all over the world, certainly in the States and in Israel, we're still at the stage of mainly putting out, the forest fires, and we're not seeing haven't had time really to look at longer term consequences. So you're absolutely right.
Okay, so I want to begin basically by coming back to the very first issue, because it's so immediate now, the issue of the vaccine. One of the things people say is, the reality is the medical world doesn't know enough. It doesn't know how long it lasts, for example. If I'm inoculated, how long does the inoculation last? It may not know about the after effects, side effects of the vaccine. And you've been very forthright in saying, yes, the medical world in many ways just doesn't know. It's nobody's fault. You just don't know. But in the face of not knowing, that plants seeds of doubt. And so the last thing I'm asking you is, from your perch, as somebody who is dealing so much with people who have survived the 2-3 weeks of the disease, but then live with the after effects, how does this doubt, how would you address the doubt which naturally comes from some of the things you've been honest about in your description of what medicine doesn't know?
First of all, I think that we have to be honest, and make it clear that there is, there are a lot of unknowns, and that that is a fact, as you've stated. But still, having said that, from what we do know, what we have learned over the last 9 months, and experience with other vaccines for other diseases, I think that the only way that society is going to come back to any kind of normality is to take that, I would say, very small risk of the vaccine. And I think it's very important, as I also said this before, that it has to be pretty much an all or none thing in terms of society. Because I think if only Democrats, for example, take the vaccine and the Republicans decide not to, or in Israel, if like half of or a third of the population takes uses the vaccine, we're not going to be able to go back to life as we knew it before.
I understand.
So I think we have to try and step up and shape up and know that despite these unknowns, the knowns that we do know, and the knowns that we do know are still that this virus is fatal in 1 to 2% of people. It's a danger to our parents and our grandparents, and it has significant after effects even for those who sail through the initial phase. And we just have to make those points very clear to everybody, and hope that people internalize it and will take responsibility.
Absolutely. Neville, kol hakavod to you, to your colleagues in the healthcare field, everywhere. You're on the front lines. The healthcare people put their lives at risk on behalf of the community as a whole. And I want you to know how grateful we all are. And I thank you for spending time and sharing your insight with us on JBS. It's been a pleasure getting to know you. We will speak again. Thank you, Neville.
It was my pleasure. Thank you very much.
The thoughts of Dr. Neville Berkman, the director of the Institute of Pulmonology at Hadassah Hospital in Israel, who's doing some outstanding work in treating patients suffering from serious after effects of the coronavirus. I hope you enjoyed hearing him. And if you want to learn more about Dr. Berkman's work with post-COVID-19 patients, simply visit the Hadassah website at hadassah.org and listen to the latest episode of their podcast, Hadassah On Call. Please remember you can be in touch with me by email with any of your own thoughts at rabbigolub@jbstv.org. And so until the next time, I'm Mark Golub. Stay safe and be well, my friends.